Hi everybody, Tyler here. Just want to give you guys an update. About a week and a half ago, I found out about my top surgery. I finally got approved after May, June, July, after 3 months of fighting insurance. Um, my date is the 26th of August. That is in 15 days, so just about 2 weeks. I go in for my pre-op, which sucks because I already did a pre-op back in May. But pre-op appointments only last for 30 days. So I have to go back up to Portland for like a 10-15 minute appointment. They'll take some new pictures of my chest for the before pictures. We'll just talk a little bit more about the process. I'll get my prescriptions um, for the pain pills and the antibiotics. Um, Now, my doctor, she works a little bit different than most doctors. A lot of guys get to go home the same day with their surgery. My surgery is at 1 in the afternoon, so I have to check in at 10 a.m. Has to be there 3 hours in advance so I can get back, do blood work, get my IV, get all that fun hospital stuff taken care of. But my doctor puts you on a 23-hour watch um, just to make sure there's no complications. Just takes precaution. So I will actually be staying overnight in the hospital, um, and probably won't be discharged until the 27th, as long as there is no complications or anything like that. So knock on some wood, fingers crossed that nothing, no complications happen. It is surgery, so stuff does happen. Um, so yeah, surgery is at 1. They estimate it to be about 3 to 4 hour surgery. It just depends. Obviously, going in, words can't really tell. Then I'll be coming home. Have my first post-op. Sorry, I'm all used to this pre everything. Um, Post-op. My first post-op appointment will be September 8th. Obviously, I'll probably see the doctor in between surgery day and post-op appointment to get the nasty drain tubes because I will be having those. Um, Now, the cool thing about my doctor is there are some doctors out there that require you to stop taking testosterone 2 weeks before surgery, which I think is nuts. Um, I don't know about any other guys out there, but I if I don't take my shot on the normal weekly time frame, I start getting super fidgety. I get very agitated super quickly. So I couldn't even imagine what it'd be like to go without my tea for 2 weeks. I did almost a year ago. I was in between doctors, so I went about almost 3 weeks without testosterone, and I about lost my mind. I will never ever do that again. Um, let's see what else. Lost my train of thought. So, oh yeah, get drain tubes. I've also some doctors ask you to like shave your armpits and stuff, especially if you're having drain tubes, because the drain tubes come out about here-ish. So if you're like me, I'm hairy like, oh, sorry, this camera's backwards. I'm hairy, super super hairy. Not only because of my heritage, I also take biotin. That has helped me out tremendously with my facial hair. Just a tip out there for you guys who are like, oh my gosh, I want my facial hair. Biotin, man, let me tell you, that stuff works wonders. Um, but yeah, my doctor doesn't require that, but I think I am at least gonna like trim it up a little bit. I don't want to get hair intertwined in my draining tube area. Um, let's see what else. I am taking some good suggestions for aftercare. My doctor said I'm not gonna need to like change gauze pads and stuff like that. At least that's what she said last time. I'm gonna obviously ask some of the same questions because it's been a little while, just to make sure. Um, but I'm talking about like scar treatment wise. Um, I've seen some good stuff and I've seen some bad stuff. So if anybody's got any good recommendations for a scar treatment, I mean, I'm not exactly too worried about it just because of the fact that I'm going to start working out and hopefully build up those pec muscles. So you can't see that line. But there will be a time where you'll be able to see them for a little while and stuff like that. And obviously, that much muscle mass doesn't gain overnight. So if you know anything good, please let me know. That'd be awesome. I will take a video. It probably won't be as good as quality as this because it'll be on my phone. But I will take a video as I, pull up to the doctor's office. I'll stop it and then add more to that video after the doctor's appointment to be like, hey, this is what I'll be taking. This is what the doctor suggests, stuff like that. I have a really cool shirt that I had purchased. I mean, it seems to be like the typical, after surgery shirt, but it's a bright blue Hawaiian button up that I want to be walking out of the hospital with. I know since I'll be staying overnight, I probably will not be in a t-shirt. I'll just be in the compression binder with my tubes hanging out and all that fun stuff. But yeah, if anybody, I don't know if anybody else has, ventured outside of having to stay in the hospital overnight after your surgery. If you can, give me some pointers or tips on things that you have needed in the hospital while you were there. Obviously, I'll probably be doing mostly sleeping, but I want to be ready, I guess is the best word to use. I don't want to go up there and say, hey, I'm the next day I'm feeling great or whatever, but they still want to keep me until like late afternoon. Obviously, I'm going to need like my cell phone charger, and stuff like that, and clothes. Gonna have, I want to be ready. Like, this is a huge deal. I don't want to, I'm driving up it's almost 100 miles, about an hour and a half, from my hometown to Portland, Oregon. So it's not like, I can just up and leave and run to my house and, grab whatever I need. But it's cool. I'm really excited. I have two moms. I have my birth mom, and then I have a guardian who raised me. She is going to be driving me up to the hospital. She's going to stay there during the day while I have surgery. Once I'm out of surgery and she knows everything is going good, Lisa, who's my guardian, she is going to then come back home and just kind of relax. But my birth mom, who we've kind of had an up and down relationship, we actually in the last year, and I can thank my ex Rachel for all of this because without her, probably wouldn't be as close as I am with her now. But in the last year, we have developed our bond, and part of me has thought about it, and I think it has a lot to do with my transition. If you see my mom and you see me, we could be like twins. It's scary, stupid. When I hit high school, wasn't we didn't look all that much alike. And then, I got into the whole boyish, dykish phase. And then obviously almost 2 years ago, I came out as being a trans guy, and being on testosterone, it's nuts. I look so much more like her now than I did in the past. And we could have been twins. Like if we are walking side by side and you're walking behind us, it's really hard to be able to tell who is who. But anyways, besides that point, her and her new girlfriend Heidi, who I love to pieces, they're also going up there with me. They both took the 2 days off. They're gonna stay up there overnight with me at the hospital. And then my best friend, yes, she's my ex, but she is also my best friend. She is also the mother to my boys. She is gonna be there. We may not be together or whatever, but she is still a big part of my life. And when I was originally supposed to have surgery, we were together and we had, everything planned. She was going to take me pre-op. She was going to, do all of this stuff. And I still wanted her to be there. She has been a huge support for me with my transition. So she's also going to be there. I think that is about it. Like I said, tomorrow, I'll take probably a selfie video, a little bit on the drive, just to express how I'm feeling, if I'm nervous or anything like that. I'll pause it. I'll take another one once I get to the doctor's office, pause that, and then take another one after the appointment. Just kind of give you guys updates. It's a huge deal. Yes, like I said, I've already had put a pre-op, but this is the legit pre-op, hands down, no questions asked. Alright, so I will make a video tomorrow, and I'll talk to you guys later.